Hi, I'm Trina McConaughey and I'm going to introduce my audience. Have you ever had a weight loss goal, a diet plan, or maybe a weekly exercise routine? Well, imagine a person dieting so much that it turns into starvation. Imagine having an exercise plan that becomes so constant that you ditch your friends, your family, and even your job just to be at the gym nonstop. All of this just to become thinner, toner. Well, there's a name for this phenomenon. It's called anorexia. And I'm sure you've all heard of anorexia in that it is characterized by excessive weight loss due to starvation, commonly known as anorexia nervosa. But there's another, sometimes overlooked form called anorexia athletica. I'm here to talk to you about both today. And I'm not here to preach to you that all exercising and all dieting is wrong. I try to stay on a healthy diet myself, and I'm even trying to train for a half marathon right now, which takes quite a bit of exercise. But when either become too excessive, they can be harmful to the body. According to the Genetic online definitions, people with anorexia are obsessed with controlling their food intake. It is believed that by controlling their eating through starvation, they can control their lives. It is most common in women during puberty, but it can also happen to them at different times, and it can also happen to men. Most people literally are afraid of becoming fat. Medic Plus states that anorexia can be caused by a number of things, ranging in both biological and psychological issues from social attitudes and personality types to genes and hormones, but the exact cause is not known. According to Genetic Online, people with anorexia deny being hungry, make excuses to skip meals, and might cut up their food and just to push it around their plate. But starvation and weight loss aren't the only symptoms. They often have an unrealistic perception of their body type. If asked to draw themselves, they'll probably draw a distorted figure, thinking that is what they look like. They often become oversensitive to any criticism and will probably withdraw from their friends and family. According to Medic Plus, some of the physical characteristics are extreme sensitivity to cold, dry mouth, blotchy or yellow skin, abnormal menstrual periods or none at all, and thinning or loss of hair. Anorexia athletica is similar in that it is characterized by an excessive loss of weight, but the primary characteristic is that the loss of weight is due to excessive exercising. According to Stephanie Line of Eating Disorders Online, it is most commonly found in pre-professional or elite athletes, but it is also known to be found in the rest of the population as well. It is most commonly found in sports that emphasize a small, lean body. It may start when parents or coaches pressure athletes to improve performance and encourage them to continue dieting or exercising more. In a story in Self magazine this month, Misty Copeland, a ballerina with the American Ballet Theater, was 5'2" and 108 pounds when she was told that she was fat. Artistic staff called her in, telling her, "Your body has changed. We'd like to see you lengthen," which, reported by Copeland, was the nice way of saying, "You need to lose weight." That talk from her coaches led to her eating disorder. People with anorexia athletica often have a lack of pleasure from exercising. They often have high anxiety and feel guilty if they miss a workout or don't work out enough. According to Medic Plus, as symptoms become more severe, some of the risks of anorexia in general are bone weakening, tooth decay, thyroid gland problems, seizures due to sodium or fluid loss, malnutrition, dehydration, depression, heart problems, wasting away of the muscle, increased risk of infection, and death in 10%. But there are a range of treatments for anorexia. They really differ in symptoms, how severe the disorder is, and really the person being treated. They range from short-term to long-term depending on what is needed, and also whether he or she needs to be hospitalized. Tests should be done to help find the cause of the weight loss and what kind of damage, internal or external, has been caused. Some of the goals of any treatment are to restore normal body weight and eating habits. A weight gain of 1 to 3 pounds per week is a healthy goal. Cognitive behavioral group and family therapy have all been known to be successful. Different programs are designed to increase social activity, reduce physical activity, and use schedules for eating. But treatment can be very difficult. Patients and families work very hard for the patient to overcome the disorder. The biggest challenge is really helping the person recognize that he or she even has an illness. Unfortunately, though, experienced treatment programs can help the person gain back the weight, but the illness is common to return. The best way to reduce the amount of people affected is through prevention. Things coaches and anyone can do is encourage someone to make peace with their body and the size. Being educated and learning to recognize a sign of anorexia can be very helpful. As Misty Copeland became more introverted with her disorder, she reported, "I started to venture out of that tightly knit world to make friends. That's when everything began to shift. I noticed that most people don't have the same rigid expectations I had about how their bodies should look. Gradually, I started to feel more relaxed and comfortable in my frame and happy with it. It's hard to remember that your body is something to enjoy, not just a never-ending fix-it project." Anorexia has a number of characteristics, from excessive weight loss to withdrawal from social groups and regular routines. It can be very harmful to the body and even lead to death if not accounted for. There are many different types of therapy between cognitive behavioral, group, and family therapies, and they have all known to be successful. But the best way to keep the disorder from happening is by prevention techniques such as learning to recognize the signs and encouraging others to be at peace with their bodies. Thank you.